bringing yourself into a postural alignment when you're in a seat. I'm just gonna, from this front on view, you can see that my knees are roughly hip width apart. So where my hip bones come out at the front, into the centre of the knee, and then from there down to about the second and third toe. Now if you've got any injuries going on in your body, that position might not feel comfortable for you. It might feel like your foot naturally pulls out if you're really tight in your hip, or if you're holding an injury somewhere. Your feet might need to be a little bit wider. What is important for this starting point is that you can tune into the soles of your feet and noticing on the soles of the feet your tripod points. Tripod points are the heel, on the pad on the base of the heel, and then at the ball of the foot, the pad at the base of the big toe and the pad at the base of the little toe. So being able to contact and connect in with those 3 points on each foot. And then just noticing, can you let the toes just gently rest into the floor. So finding that space, and it might be that the height of your chair isn't quite right. If your knees are up here, your chair is a little bit too low, and if you're up in a stool, then your feet are not going to necessarily be anywhere near the floor. So finding a seat that is a good height for you. Dining room chairs generally are an okay height for most people. Depends on the height of your body, of course, and the length of your legs. If your knees are up a bit, so your chair's a bit too low, then you can always stick a cushion in underneath your backside to lift you up. If your floor is a little bit too far away, you can always stick a cushion or a couple of thick books, like firm thick books, just so that you've got this surface that your feet can rest into. Now once you have that position, I'm just going to turn the chair round so that you can see what's happening side on. From this side on position, I'm not sitting leaning against the back of my chair. I might do that for some things, but not in this case. I want to be sitting up tall so that the ear is over the shoulder, is over the hip. And that's what your postural alignment would be in Pilates. Now when you're in that position, something else to check is that you're not thrusting the ribs forward and creating a really deep arch in the lower back. So if you have a little giggle to yourself, you will notice that the ribs draw in, and that's where we want the ribs to be, in that kind of drawn in position. Your chin is dropped down so that the neck is long. We're not sitting up here. Equally, we're not sitting with our head hanging forward. So that chin drawn in to allow the ear to be over the shoulder. Now if you're really tight in your body, if you're tight in the neck or across the chest or the shoulders, to bring yourself into that alignment might be your starting point. That might be the work for you, in which case you practice drawing in and then let your posture slump. And this is good for everybody to practice, is letting the body slump and then coming up and drawing the posture in and letting it slump and drawing the posture in. Now a couple of things to be mindful of when we're starting to draw the posture in is keeping this connection through the soles of the feet. So when in Pilates, when I talk about having active arches, that's where we've got that connection with the floor and we can start to get this doming effect happening in our feet. So if you find that really difficult to do standing up, it might be that you practice it sitting down to start with. And as you get those arches to lift, you might notice some activity happening in your legs. If you don't feel that straight away, that's absolutely fine. You just practice. Get those active arches, and then can you maybe engage into the legs and into the backside a little bit, and then let it go. So this is a tiny movement of activation and release. Activation and release. And even in the release, I can still allow my body to be held in alignment without coming all the way in. But as I said, alignment might be your work, so it might, when you let go of the tension, it might be that you need to release even further to come into whatever your habit is, whatever your postural comfort place is. Let it go there and then come back up, and let it go and come back up. So that can be your starting point. That can be all you need to do for your own personal session. If you can then layer in your breath with that, so exhale, activate, inhale, let it go very slightly. Exhale, activate, inhale, let it go very slightly. So whether you're seated, whether you're standing, whether you're lying on the floor, when you're getting that activation, it should feel like everything inside is drawing up and that your body's becoming a little bit narrower. Almost like you're trying to pull your body in away from the clothes. And letting it release and engaging and letting it release. So this might be what you practice. If you've got any questions, you know what my email is, jen@iamjenwilson.com. Send me an email if you've got any questions at all and I will do my best to help.